The medical and teaching aids are contributions from the children of cash-level staples and Forces Country Day School in the USA. The children, through exhibitions and community events, raised over $7,000 to support the Ghana project to improve sanitation, provide health care and education to children in deprived communities under the campaign for maternal mortality initiated by Mrs. Ernestina Mills. 3 schools have benefited from the donation. They are Fayef International School in Kokrobite, Odoye Asem School at La, and Bonikope Primary in Sege. Mrs. Ernestina Nadu Mills was appreciative of the support to the deprived communities and said this will help improve the quality of life of the children.
I'm so encouraged by the happy look on the faces of the children and the parents, because for the first time their children have a school in their community that they can attend. Yes, otherwise they have to walk long distances at the mercy of the weather to schools nearby.
Professor Medj Owen, who is also the director of the Kybele Foundation, a US-based NGO dedicated to improving safe childbirth, pledged continuous support to the welfare of the Ghanaian child.
It's been a very good experience for all of my group, and the Ghanaians have welcomed us with open arms.
The foundation has also been of support to the Ghana Health Service by providing health equipment and expertise in child care. Mavis Ofei, GTV News, Accra.
People, I thought there was a problem. Perhaps I could lend a hand.
Good morning.
It's good to see you.
Good to see you too. Thank you so much for receiving us. This is my young daughter, Josie.
Oh, hello. How are you?
Good, thank you.
Good. This is your first time in Ghana. Good. I hope you enjoy it. Hello.
Hi, I'm Cashlyn.
Good. How are you?
I'm good. How are you?
I'm good. Hello. How are you?
I'm good.
Good. Hello.
Nice to
How are
meet you,
you?
Mrs. Mills.
Yes, I'm pleased to meet you too. So far, have you enjoyed your visit?
Yes, ma'am.
Good. Hello.
Hello. Chris Holly. Nice to meet you.
Nice to meet you. Hello.
Hello, Your Excellency. Parker Lovell. Nice to meet you.
Reminds me society too.
Yes, please.
Yes. Thank you for the way. Hello. Hello. Is this your first visit here?
Yes, I love
Good.
it.
Good.
Thank you.
It's a bit warm here.
Yeah, but we've loved it.
Okay, good. Yes. Good. And the wood is very good too. You know, I didn't realize they were being made here. And I was thinking, how are you going to bring all these things with you on the plane? But when I went through the letter, I realized that you had them made here. Thank you very much. And
We would rather support the local economy in
Yes,
ways
yes.
we can.
Yes.
Other things we can't easily find, we bring it. Other
Good.
things we can find here, we would rather have it made here.
good.
So this
I'm
is,
glad I asked you for them.
so am I.
Yes.
So this is a medicine cabinet that
Yes.
will be mounted on the wall.
Okay.
We have one small bed that will be put together, and then here's a
Okay.
mattress for the sick
Okay.
children to lie upon.
Yes.
And we have a desk for the nurse,
nurse, yes.
and with a chair with it.
Oh, good.
And then we have. It may be a bit heavy. We
You
might
okay?
be better to take them inside because
I think once the cameraman is here, so that over and over inside.
we'll need to empty them also. So.
Okay. How come there's no boy? I thought that one boy.
Chris? This one, he's not so small.
Oh, okay. I was thinking. Yes, good. Yeah, so,
Thank you. Well, actually, this is yours.
thank you. Every time you do something for me. You sit here and you can sit there. If is there any yes. There's one more table.
Oh, coffee.
Then you can take this one.
Thank you.
There are more chasing. Everybody else.
Good morning.
Good morning.
Hope everybody is fine. So, this time around, I know you've been in and out of Ghana several times.
Different pathways. They've all been a blessing to our lives. I believe the Lord has woven His timing into bringing us here in these 3 schools at this time. The first school project is in a very poor school in Law. My group is represented by Mrs. Parker Lovell. She runs a horse riding academy in the United States, and 4 of the children ride horses in the academy. And the academy takes on philanthropic projects. So Parker knew of my interest in coming to Ghana, and so we sat together and we said, why can't this be so? And so with that, we were looking for some projects here in Ghana. So we found one project in Law. It's a very poor community school. It's called Odai Atsum Memorial School. It had no running water inside of it, very poor sanitation. Simply there were no walls on the school, just simply some boards that were tacked up. And so with the support of the Riding Academy, our children themselves raised over $7,000 by selling lemonade, by emptying their little piggy bank, their small money. Children were lining in her office to bring the money to support the Ghana project. They were so excited for it. And so as the momentum for the project built, we had a lot of other layers of support. So with the money that the children raised, we simply, it's been now close to a year, January. It was January when the water became installed in the school. So it took several months to get the permits, to dig the street, to put the pipes. So now that school has water. So we visited that school on Tuesday and Wednesday, and the children were suddenly in the middle of all the Ghanaian children. They are all together playing and having a wonderful time all together, doing songs, learning from each other. And 4 of the children also attend the same school in the U.S. And so the school also wanted to be supportive of our project. So all the 4th and 5th level students in their school wrote letters to a child at the school there. So we brought the letters down. Every child received a letter. And in turn, the children at that school wrote letters for us to take back to the children in the U.S. But one of the letters was very special, and so we pulled it apart. And we also would like to acknowledge the passing of your husband and express our sincere condolences for that. And I wanted to present you with this that came from a student there who didn't even know we were coming to meet with you. So. And the activities at that school this week, we planned an art project. And so we had small wooden horses because it's from the Riding Academy. We brought paints and paintbrushes. I don't know if you know what glitter is. It's a very sparkly powder.
Well, the name suggests it.
Yes, glitter. So we started, we had 3 projects for the children, and all of them did 3 art projects, or 2 art projects and 1 activity. It started out very organized. At the end of the day, all the children were covered with glitter. There was glitter everywhere, and everyone was having such a wonderful time. So that was one project, and we also then put all new furniture in that project, and they received a library with 300 books and also many other basic supplies that they need. The second project was one in Kokrobite, also with an orphanage and a community school that has 250 children in it. And there, that project there was to set up a computer lab. So about a year ago, it was just a cement slab on the ground. And so I was taken there and I saw it, and I felt the heart of the people and their true determination to do it. So I said, okay, we'll do it. So I gave a little bit money, and I came back a few months later. The structure was built, the roof was on, the windows were on, the doors were on. I said, let's go. So then the school of the children is named Forsyth Country Day School. They donated 22 computers for us to bring down to Ghana. So now we have desktop computers and laptop computers that have been distributed to the schools. So yesterday we were there, and the children themselves did an amazing ceremony for us with dancing and drumming. It was wonderful. And of course, the third project is for your school, for the health room.
Thank you very much. You are doing so much effort to improve basic education in this country. I looked for a deprived area, and by deprived I mean deprived. They don't have running water, all that you can think of. So I sent some university students to look for such a place, and they came out with 3, and I chose one. And I didn't go there until, the land was easily released. And then the day I went there, the first time I went there was to cut the sod for the building of the school. And after 7 months with problems, problems that we could not control, we were finally able to finish the school and hand it over to the community on the 12th of November last year. That's just about 1 year last year. And the school has been running. It's in the public system, and I've had a computer lab face there and a library, and I mean to do more for them. And I'm so encouraged by the happy look on the faces of the children and the parents, because for the first time their children have a school in their community that they can attend. Yes, otherwise they have to walk long distances at the mercy of the weather to schools nearby. And it's a basic school. When you have a good basic education, doors open for you. And I'm happy it's working. It's working. Last year at Christmas, I had a party for them. They had drinks and rice and beef and fruit and vegetables, and I had pictures taken of them. I don't have the album here, but they were very happy. And this, as a school child should be, because I was very happy as a child. You see, you are a child once in your life, so take every good opportunity that comes your way. Once you are grown up, you are responsible for yourself. When you are hungry, you have to find food and new clothing and all that. But as a child, somebody else is taking care of you, because it's your right. Once they bring you into this world, they have to take care of you. So do your best so that your parents and teachers will be happy. And then you'll be an asset to the community, not only to yourself. So try and pass all your exams. This is my advice to you. I love working. I was once a teacher, and I taught secondary school students, and they are in all areas in society, and I'm very happy. So don't waste time. Oh, of course, you must find time for play. And I heard Professor Owen say you took part in some activities at the school. Were you happy to meet the children?
Yes, ma'am.
Okay. Have you made friends?
Yes, ma'am.
Good, good. So how do you make up for time, the school time?
We were fortunate in that Parker and I struggled a bit to know when we should bring the children, and so we thought about September, but I don't know. It just seemed like this week was going to be the best week. We have a Thanksgiving holiday in the U.S., so we thought they would miss 2 days of school. But as it turned out, the school decided that they would give also Monday, Tuesday as conference days, and so they've not missed any school at all to be here.
Good. And they've gained by traveling all the way to Africa for the
Absolutely.
first time, I suppose, for all of you.
Yes, it's all their first time.
Yes, good. But I'm happy I asked you for the equipment for the health room because sometimes children go to school and they fall sick, especially of malaria, dizziness, headaches, and they need, before they get medical attention, they need a place to lie down. Sometimes their homes are far from the school. And I have plans to look for an experienced nurse, maybe a retired one, to man the health room during the day. Yes, not to administer serious drugs, but like things that will take care of fevers or headaches. So they need a decent place to lie or to be kept. So I asked Professor Owen for equipment for the room, and she asked me several times to give her an idea. By the time I was busy, I just couldn't. So the things I inspected had a table for the nurse and a chair and a bed and a medicine cupboard. Yes, so thank you very much. I asked and I was given because I want to strengthen our relationship, our friendship through this. Yes, I'm very happy. Thank you all for accompanying the children and Dr. Owen to bring these things. Good. Yes, so perhaps maybe we'll inspect the contents of...
We can expect the
Yes.
Yes, we
Yeah,
can.
okay.
Yes. If it's easier, we can also send a list of the items.
Oh, okay.
Because we put that together.
Okay.
But we have, and here's the other, let's open this one too, Sammy. So what we did, so we'll pull out some things. So we have some posters that we put up because hygiene is very important, and the importance of hand washing can help prevent infections. So we have some posters.
There was a campaign last week or two about hand washing. Thank you. So these would be very useful.
So we have gloves,
Gloves, yes, certainly.
swabs,
Thank you.
tissues. We have a variety of medications for this one is for the scrapes, for the skin protection, and we have some antibiotic creams to put on the skin infections. So there's a variety of all different medications that none of them are prescription medication. They're all the things that would be sold in a local pharmacy that would be in a haze. And we have.
Thank you all for your contributions.
Yeah, let's get the big pack of that. We have many, many, many bandages that they put on a scrape. There's many, many of them. Some gauze wipes that are sterilized packages if they get a scrape. Cotton. Those will get well. I don't know if you have here, but we put it on the wind.
Yes.
One of the gentlemen in the group said that he thinks it's explosive, so we brought it on the plane. But nobody said anything, so we're okay. Fortunately, nothing happened. We all made it. We have some vitamins.
Oh,
vitamins.
okay.
This is a blood pressure cuff. If the child feels faint, or this is to take the blood pressure. And there's also a stethoscope.
Okay, for
Okay.
the nurse, yes.
Yes, and this one is to take their ear temperature. If they have a fever, it's a small device that you, and if you need me to, I'm happy to come back and train the nurse.
Okay.
Once you hire. But it just is a little cap that goes just gently in their ear. It tells you if the student has a fever.
Oh, okay.
And we also have some school supplies, some pencils, some colored pencils. Where's the Tylenol? We have several types of medicine. This is a Tylenol for the children for the headache or also for the fever. And there's also some Benadryl if they get a bug bite or have some kind of an allergic reaction. It's also something to calm the reaction. So different antihistamines.
Thank you so much.
This is if they have an upset tummy. And this is also for the fever. It's Advil. It's we call non-steroidal anti-inflammatory medicine. It's for muscle ache and pain. Okay. And this is an antacid also. So more vitamins. If any of them are malnourished, these are multivitamins. This is serious. But in case a child has any severe problem, this is called an ambu bag, and we use this in the hospital for resuscitation. But it's if there's an oxygen, this can go into the oxygen canister. But this you put over the nose and mouth like this, and you squeeze the bag, and it can give them a breath. So if any of them got so severely sick that they were collapsing, this would be good to have as well. And so there's people at the children's school, at the academy, friends and family, once they knew we were doing the project in the school and the health room, we were overcome with the generosity of our friends that wanted to support. So then there's some small hand wipes and cleaners. You'll see.
Thank you so much. I'm over. Start giving at a very early age. I'm sure you will continue with that. I'm so proud of you. Thank you. May God bless you.
Thank you very much.
I first met Professor Owen at the Ridge Hospital, regional hospital. He had me with a bag, and I was surprised to notice that it was made here. So she brings so many things, and she said in one of her things back home. And thank you very much. The maternity theater that you hospital is just too much. It's a regional hospital, and you have done a lot. You continue to help, but there's a lot still to be done. I think very bad cases are sent there. Therefore, that has already gone into trying to bring it to standard. Too many people go there, and it is difficult. But like I said when I started, you put in a lot, and it's helping. Yes, and you were asking for a shed to take care of follow-up.
Excellent.
Yes.
Excellent shed. Yes, we need it desperately.
Yes.
In fact,
Yes.
the numbers continue to go up, and I feel myself, my heart goes out for the staff because they're helpless. The patients keep coming in, and there's no space to put the patients, and they midwives in a room filled with women all in agony. So this is an issue that we'll continue to fight together but I would also like to see the difference that it's making. So we're collecting some outcome information. And we found that before the theater was built, it took a little bit more than 4 hours for a woman to have an emergency CF. Even though you have more patients, the theater alone is making a big difference. And we'll continue to work to institute some quality improvement measures to improve efficiency even more. So I'm happy for that. And also with the project that we've done, we're doing now some risk adjustment calculations because as we discussed before, we've had to estimate the true value of the program because we've had a double number of patients that have come in since we started it. It's gone up by 50%. And we've also had a quadrupling of the sickness of the patients. So therefore, we're getting more patients, and they're ill, and we have the same number of staff. So, but even with that, we've calculated now using some statistical risk adjustment assessment that we've saved over 800 maternal lives through this project. So we are, Dr. Schrofanio is coming with me to U.S. We're going to be presenting the information at a meeting and talking to some other people at the University of Washington because we believe what we have here is a very unique model and not many people in the world can claim those kind of results. So we're really pleased about it and we'll continue to work hard.
We appreciate the kind of profit to also lend a hand in upgrading the situations in hospitals, especially at the Ridge Hospital. Ridge Hospital serves, it's a regional hospital, and it serves a lot of people, more than the staff can handle or the facilities can handle. So I'm appealing to Ghanaians who are in a position to help upgrade Ridge Hospital and other hospitals in the country. We shouldn't always expect help to come from outside. There are things we can do for ourselves. So I'm appealing to Ghanaians who can help to do that. If you go to the Ridge Hospital and you see the General Overseer, he will tell you exactly what help will be needed. And Ms. Osedutu, I thank you very much for supervising the making of the furniture for the health room. Thank you so much, everybody here who came on this trip. This is a special one. Thank you so much.
Thank you for receiving us.
My pleasure. We used to be number one. I don't know what's happening, but soon we'll get there again. So this chocolate made from cocoa beans grown here in our country, and they are manufactured here, and some drinking chocolate. I'm sure you start enjoying them right now. You know, I think there's sugar and milk added. So I doubt if there will be any left to take back to the US. So thank you very much. Thank you. You have such good hearts. I can't thank you enough.
I have, if I may add one more thing.
Yes.
The work that they have been over backwards to be of assistance. Mr. Broby in the headquarters, and also our driver Sammy and Abigail. They're with us 24 hours, 7 days a week when we're here, so we're able to accomplish what we need to do. And it's been the IT support system at the Ghana Health Service. They were able to help us load all the computers up, get them out of the customs at the airport.
Thank you very much. Thank you. My memories of this visit and of all of you and those back home helping will never diminish. I thank you very much.
Our pleasure. Children can share.
To start with children
Yeah.
at a tender age
Yes.
and to try to incorporate a passion for giving, to try to foster that in the children. And so thank you for encouraging that and for receiving them. This has been definitely not only a highlight of their trip, but a highlight of their life to get the opportunity to meet you. Thank you.
I know Bray had a
Fallen in love with lots of children here.
Good.
We would love to take all of them home, but since we can't,
You can.
the children are already planning to come back, and we said home to sell lemonade, and we'll pay our own way next time.
Oh, good.
So they'll be back.
Good. Something that's not common in our system is horse riding. Yeah. Can you tell us about?
You may, absolutely. Please.
Sorry, my mom and a lot of other instructors teach lessons at our barn, and the youngest we teach lessons to are 3 years old,
See.
and
How much do the horses
you know, it's really cute. And Josie, subscribe.
Have you fallen off a horse before?
I've fallen off so many times I stopped counting.
Okay.
What do you
Yeah.
want to add to it? This is the horse I got for Christmas last year.
From who? Your parents?
My parents.
Oh, good, thank you. I see. It's a big one. Do you always start with a grown-up horse or a baby horse?
It
A grown-up
depends.
horse. It depends.
I mean, if you know,
I
The
see.
heart
So
of
is
the
that
horse
you?
is more important. The heart.
This you.
yes,
I
my
see. She looks big there on the horse. Good.
His name is Tommy.
Tommy.
and
Okay.
that's her showing, because we have an indoor arena at home, and that's where you're learning. And then we go to horse shows, and that's during horse shows, and you can show an academy, and that's when there's no difference really. It's just in academy you show we bring about 10 horses to academy, and they switch showing, like the riders will switch off showing horses. But if you're in Josie and I, or Josie and me's level, then you'll show, you have your own horse and you show, nobody else shows your horse, it's up for you.
See.
Trainer.
So what would you like to do when you grow up in high school?
I want to be an equine anesthesiologist.
What?
I want to be an equine anesthesiologist. That's a
A horse anesthesiologist.
Oh, okay. What would you like to do when you are grown up?
I think I want to be a doctor.
Okay. Which area? First you be a doctor and then you decide what you want to do. What do you plan to do when you...
Just something with computers in that sort of department. Not really sure what specialization.
Oh, okay. What would you like to do?
I'm not too sure.
Yes, it takes time. Yes, it takes time. I understand. Good.
Chris actually headed up computers. We fly them to Ghana, we hook them up.
Oh,
No. It's so complicated.
yes.
And all of the exchange of information and reloading software and purchases and backup drives, and I can't even, they talked and went over my head.
Yeah.
City, we can go to Disney World, we can go anywhere to the mountains. He said he didn't know anything about my connections. People Sammy met when he came to U.S. was Parker, and he went to ride a horse over in the same academy where the children are riding.
And I have to say, he did a terrific dismount.
And Miss Parker was beside him, and he went about 10 steps on the ride. He said, I want off. And I said, no. I said, you are not coming all the way to America to ride a horse, and you're not getting off. So
Sorry, I don't know this.
just write your Josie. If not, she was wanting her full name.
As the bucket gets filled, we'll just throw the water away, since we can have all the plumbing work done.
The child drew it.
Zip mo po na kayo. Put your clothes down and help.
Yes, ma'am.
Take us to the car.
Yes, ma'am.
Oh, okay.
Very good.
Yeah.
Perfect.
Thank you. What a lovely day it's been. You know, I realize that if you twist the whole thing, the label will come off.
Oh, I got it.
Oh, that's wonderful.
Yeah.
Thank
you. Okay.
There we go. I'll send you.
Thank you.
Thank you, Mrs. Mel.
Tell me why you are here in Ghana, or you coming to do the project you've done so far, and why this particular visit to the former First Lady?
Yes, we are here in Ghana with the group of first-time children that have come to Ghana and adults to do service projects in 3 local schools, one of which is supported by Her Excellency herself, Dr. Mrs. Nadu Mills. And she has asked my help to set a health room in the school that she's sponsoring. We've also installed a computer lab at a school in Kokrobite, and as well new furniture for a school in Law. It's been a very good experience for all of my group, and the Ghanaians have welcomed us with open arms.
How long are you staying in Ghana? How long have you been here?
We've been here for 8 days.
And how, all of these 8 days, what have you been?
We have been working in these 3 schools.
Then name the schools for me. Kokrobite, La, and
Fayette International School in Kokrobite, Odai Atsa Memorial School in Law, and Her Excellency's health room in her school. We've not visited that school, but we're meeting here in her office to present the items that she's asked.
is that the first time coming to Ghana?
No, I'm Ghanaian. I've been coming to Ghana since 2003. I come 2 or 3 times every year. I'm mostly bringing doctors and nurses. I'm the president of an NGO named Kybele. We've been doing extensive work in Ridge Hospital in the ONG, and it was at the new theater inauguration that we met Her Excellency in March, and then that's how we've become acquainted.
Okay. And after today, will it be the end of it coming to Ghana, or you have other projects? And I want you to explain further your project, the projects that you do.
I'll be back myself in January with the group. I come to Ridge Hospital 3 times a year. We also are doing work in Tamale in the north. We'll have active projects with the Ghana Health Service. So I'm normally coming with doctors and nurses from around the world. This time I decided to bring a group of children and parents to do a service project, especially because the First Lady herself asked for some help in that education is one of her priorities, and so therefore I respond to her with her request with an open heart. And we had an outpouring of love and support from the schools in the U.S. and from many families and friends that sent things along for us to bring to Ghana.
Thank you so much.
Thank you very much.
You see some big boys and girls in primary school because they want to get their education.